All right, next up we have Jessica Lewis, Expect With Me, Revolutionizing Healthcare by Reducing Costs and Improving Outcomes.
Thank you. Good afternoon, I'm Jessica Lewis, and I'm excited to tell you about Expect With Me. Being born too early can cause short and long-term health problems and is the third leading cause of infant mortality worldwide. 15 countries account for 2/3 of the world's preterm births, and we're one of them. Our preterm birth rate looks more similar to that of Afghanistan and Central Africa than it does to the developed world. Our preterm birth rate is 10% in the US, and it's been rising the past 2 years at a cost of at least $38 billion per year. We've tested a solution to preterm birth through 2 randomized controlled trials funded by the National Institutes of Health and a large-scale dissemination study funded by the United Health Foundation. That's $15 million in research funding. What we found is that our solution reduced preterm birth by 1/3 to nearly 1/2 across studies. We also found significant improvements in things like low birth weight, neonatal intensive care usage, depression, postpartum weight loss, and both patients and providers were much more highly satisfied with this type of care. Colleagues at the March of Dimes and Optum took a look at our data, and they concluded that we had saved $890 per pregnancy for enrolled participants. So what is Expect With Me? Expect With Me is an innovative model of prenatal care. Typical prenatal care after an initial intake visit lasts about 10 to 15 minutes, which is enough time to do the requisite medical checks, to answer 3 or 4 of the 1,000 questions a new parent will have, and to do a little bit of education. Expect With Me brings together 8 to 12 women all due the same month for 2-hour-long appointments with their provider. It runs on the same schedule as traditional prenatal care, so that's 10 2-hour-long visits with a provider across a pregnancy. Every woman gets a brief one-on-one checkup, and most of the time is spent in a facilitated discussion on the topics of pregnancy, where women can give and receive social support. They can get all of their questions answered because you have the luxury of time to do that. They build skills, and we change social norms toward healthier behaviors using an evidence-based curriculum. We built an IT platform where women can track their own health metrics, access online resources, and connect with one another through a social media platform. Despite widespread interest in excellent outcomes, there's a problem. A lot of US women, only about 3% of them have access to group prenatal care. Bringing these kinds of evidence-based programs that we develop in academia to scale is difficult. To bring group prenatal care to scale, you need to change IT systems to accommodate for electronic medical record documentation for group visits. You need to train providers to deliver care in a new way. You need group space. And prenatal care providers don't generally get reimbursed based on outcomes. So they do the hard work of changing practice, but they don't accrue the cost savings. The payers do. So what's the solution? We believe we can revolutionize healthcare by creating virtual groups and delivering evidence-based programs through telehealth. Women can continue to receive their 10-minute one-on-one provider visits in traditional prenatal care. In parallel, we could convene them online in virtual groups where we could do the education, the support, and the changing of social norms toward healthier behaviors. We can capitalize on the power of technology to expand access and the power of group care to improve outcomes and reduce costs without the barriers involved in changing the whole health system. We've assembled a team that includes Jeanette Ikovics and I at the Yale School of Public Health and an entrepreneur in the field of healthcare technology with significant sales experience in telemedicine. With 4 million births a year in the US, we think that there is a significant opportunity to sell this both to payers and to businesses that self-fund their health plans. We are seeking strategic partners and investment to pay salaries for an initial team, to add to our technology platform group telehealth capabilities, to identify initial customers and launch with those customers. Yale is already evaluating a deal for their own innovation fund. Once we've done this formative work, we can then extend into other health conditions where we can offer evidence-based group telehealth programs to improve healthcare and save money. Thanks for your time.
Are there any differences among demographic populations in the rates of early delivery, and how does your platform cater to those different demographic groups, if there are?
Yes. For example, African American women have much higher rates of baseline preterm birth. We've actually found through one of our randomized controlled trials that we had a 33% reduction in preterm birth, but a 41% reduction in preterm birth among African American women. We've seen in our latest study, too, that we are actually closing health disparities through this model as we are offering more support and more education. Absolutely. We've moved the needle on a host of maternal-child health factors, but group care has been proven amongst a lot of health conditions: chronic disease, diabetes, addiction, weight management, and so all of these could really be put in the group telehealth space. Thank you.
Great. Thank you.
Thanks.